Hi, my name is Kelley, and today I'm here with Odie. So how are you, Odie?
I'm great, thanks. For yourself?
I'm pretty good. So Odie is a 19-year-old student at university. She is very active with her tennis and swimming. So what Odie has what's been bothering you the most, you said, was that you have a large history of ankle instability. You've done your AITFL, anterior inferior tibiofibular ligament, a couple times, and you've also been experiencing low back pain, so like right in the middle, and that's worse when you exercise more, do more activity.
Yeah, it gets worse as I exercise.
Yeah, okay. And then the last thing you said was that she's also been experiencing limited spinal flexion which is largely due to your tight hamstrings. Okay, so today we're gonna target all those things that are bothering you through a few aims today. So number one is to retrain lumbopelvic stability. Number two is to increase ankle stability and increase ankle proprioception. And then the last one is to increase mobilize the lumbar spine, and then in doing so, stretch the hamstrings. So those are our aims today. Does that sound good?
Sounds great.
Awesome. So the first few exercises we're going to be doing around the Cadillac, these ones are all focused on mobilization. So the first one we're doing, I'll give you a demonstration.
Do you want me to move off this or stay here?
If you pop off, that'll be great. So this one's called lift and lower. So for this one, I've got one red spring and we've got the safety bar attached. So I'm just going to give you a demo. This one's really good for stretching those hamstrings. Get a nice nerve stretch, which is good for your mobilization. And it also actually helps with your low back pain because it's very entry level lumbopelvic stabilization, which really helps with your low back pain. Awesome. So I'll give you a demo. So what we do, which will slide backwards, put your head right at the top of the Cadillac. Awesome. Get nice and set, and then bring those legs up. And I'm going to help you do this, but I'm just going to push with my own hands. And you're going to pop your feet on here. Awesome. Hips nice and hip width apart. And what you're going to do is, you can start in a pointy toe position or start here. But so I'm going to start in that pointy toe position, hands by your side. As you inhale, push out. And then you're going to exhale and dorsiflex, which means to bring those heels closer to the sky and the toes towards you. And then we're going to do that 8 times. So like this, keep your hands by your side, and you're inhaling as you come up, exhale to do that dorsiflexion movement. Awesome. So does that sound right to you, Odie?
Yep. Sounds good. I'm going to be so inflexible, just telling you that
right
right now.
So we're going to modify this for you. We'll just start in that neutral foot position, not the pointy toe, because of your tight hamstrings. So do you have a lay down? So head right at the top here. Don't hit your head on this, please.
Don't worry about that.
So so head still on the highlight.
Still on it?
Yeah, that's awesome. And it's all okay if I touch you, move you around?
Yeah, go for it.
Awesome. Okay, so I'm going to push this up and just pop your 2 feet on here, over your toes.
Yep.
Awesome. And just relax those arms by your side.
Soles for the feet.
Yep. And first, so inhale, push the bar up. Stay. Inhale, hold it. And then bring those toes closer to you. Just very lightly. Not very much movement, Odie, because you're quite tight in here. Just a little bit. And just so you're inhaling to push up, point the toes, and breathe out. Toes towards you a little bit, not as much. You're quite tight.
Soles.
Yeah, awesome. So do 5 more here. Awesome. Is that feeling okay?
Tight.
Yeah. So this exercise, as I said, is a nice mobilization of your nerves, and it also stretches those hamstrings, which is what have been bothering you. And it also kills 2 birds with one stone, as I said, because it retrains that lumbopelvic stability as you're keeping those hips and lower back nice and stable, which will help with your low back pain. Awesome. So we'll do 1 more after this one. Relax, and then I'm going to help that bar come down, release those feet. Awesome. Great. So that was alright?
Yeah.
Awesome. So that's a nice warm-up exercise. We're going to do a few more. The next one's not as challenging or as painful.
Okay.
Awesome. So do you want to have a sit up? And
Yep.
then if you stand up. The next one we're doing is called half roll down. So this exercise, actually it does strengthen your abdominal muscles. So your tummy muscles, which will help with your low back pain. But it also is a nice mobilization of the spine, especially the lumbar spine, into flexion. So nice movement happening. Awesome. So with this one, I've got one red spring again, but it's attached through up here. And I'm just going to release this one first. Awesome. And then I'm going to attach this through the top. Yeah. Awesome. And I can take this bar off now because this is holding up the top. So I'll just attach this up here. Keep it out of the way. And I'll just give you a little demo. So pop that one out of the way now. So same thing, laying down, head at the top of the bed. Top here. So what we're going to do, we're going to pop hands, so palms to the sky. Grab the bar. We're going to come down and pop your hands a little bit wider than your shoulders. Awesome. Great. And then we're going to bend our knees up. And what we're going to do from here is nice big deep breath in. And as we exhale, we're going to curl our head, and then we're going to move down the spine to curl like the letter C. Come up until our elbows are at 90 degrees. Inhale, hold this position, and then we're not going down yet. We're just going to bring our spine, our lower back onto the mat. Exhale, come down. Keep the shoulders nice and stable. We're not doing this. They're staying in the same position. And then we come back up and we repeat that 8 times. And then we're going to come back down and the exercise will be done.
Yep. Right.
Does that make sense?
Yep.
Awesome. So you lay down, and I'll bring the bar down to you. So bring your head a little bit further down. Awesome. Great. So bring this. Yep. Perfect. Perfect. Awesome. Please add. Great. Okay, so when you're ready, so those shoulders are staying nice and still here. Awesome. For this exercise, I'm going to be really watching that you're doing a little bit of it now. It's the rib cage flap. So I'm going to keep my hand on here, and I want you to squash the lumbar onto your back now. So hold that nice position there. Awesome. All right. So we're going to come up into that right angle, and come up. Yep. Curl up, up, up. Keep going as high as you can go. Inhale to hold it. Keep it 90 degrees. And now exhale, lower a little. Don't let my hand touch the ground. Just the lower back that's touching, and then come back up. So it's working those abs, isn't it? Which will be good for your low back pain. Awesome. Yeah. So seeing a little bit of your shoulders, your scapula, like your shoulder blades rising. So I want you to keep them nice and locked in.
Okay.
Awesome. That's very good, Eddie. Yeah. Perfect. Imagine those shoulders still, and I'm just pulling you up like a string, with a string. Coming up, and then come back down. Keep the 90 degrees. Shoulders nice and stable. Well done, Odie. Awesome. We'll do 4 more of these.
Okay.
Doing very well.
You go over in the face now.
Gosh, and you're having a little bit of doming of the abs, so just remember that TA contraction. Remember, pull the belly button into your spine. Yeah, that's better. That's less doming. Well done. Awesome. Great. We'll do 1 more now. Awesome. And when you're ready, you can exhale, slowly come down, and I'll grab that bar from you.
Sweet.
Awesome. Well done, Odie.
Thanks.
Yeah. Okay. So we have 1 more exercise on this funny little connection. This one is called overhead reach with roll up. So I'm going to give you a demo of it. Here we are. This one, not as high on the springs. We've got just 1 blue on this one. And again, we're doing 8 of them. Here we are. Keep that one out of the way. Another one where we're laying on our back. So with this one, so we're going to lay down Our starting position is nice and relaxed with our arms overhead, same thing, but instead of having our hands like this, now they're facing the ground. So, yep, so head right at the top, not dangling over. Same thing with your hands a little bit wider than your shoulders. And our start position is just here. So this one's really good on, I'll give you a demo to explain how it does what it does. So, say all of our principles, and what we do is we come through here, up, and then slowly roll all the way back down and arms through. So what we're doing with this exercise is we're controlling the spine into flexion. So we're bending this part of our spine.
So C curving.
Yeah, C curving. And we're controlling the movement for motor control, which also helps with your low back pain. So I'll show you one more time from the start. So we're here, and we're coming up. So let your arms come up, set your shoulders, don't let them move around, and we're letting the spine come up. So we're rolling up, and then all the way back down.
Yeah, awesome.
That sound good?
Yeah.
Awesome. So give that one a go.
Do you want me to grab the bar all the way down?
I'll bring it back to you. So if you want to pop your hands overhead. Awesome. Yeah. So hands a little bit wider. Awesome. Just relax. Don't let that tummy come out. We don't want the muscles in here to be contracting either. Just squish that glute very under here and bring the belly button into the bed to turn that TA on.
Yeah.
Awesome.
So my legs just like fit distance away out.
No, just nice and relaxed. Very good. Okay, so when you're ready, you're going to keep your head still, let it come forward. Now you're going to set your shoulders, don't move them, and let it pull you up. Awesome. Inhale, hold. And then you're going to tilt that bucket of water posteriorly. So we're going to tuck our tail between our legs to come back down. And when you get there, and then exhale to finish it off and go back overhead. Very good. Okay, you've got 7 more to go. Come up. C curve, very nice. Set those shoulders a bit more. And then tuck your tail between your legs. Very good. Keep those shoulders. Next one, we're really going to focus on keeping those shoulders set. So it's when you're rising, it's very easy for your shoulders to rise with the bar, but you want to keep them nice and still, locked in. Very good. And then tuck your tail. Very good. So it's almost like when you're up the top, you're like a happy cat, like anterior tilted. So the happy cat position, and then you tuck your tail, bring it back through. Awesome. Are you feeling alright? So halfway through these, you've got 4 more. And just take a nice breath when you finish. Just reset and start again. Very good. Awesome. Yeah, so just let yourself relax there. Set the shoulders and then go again. Awesome. So it's sort of like a Superman movement. Gosh, doing well. You could move your hands when you come to the top just a little bit more, and I don't want you to hit your elbows on here. Very good. And 2 more here, and then we're finished with the Cadillac. Very nice. Superman up, and then tuck your tail, come back down. Awesome, last one. Push up. Awesome, keep those shoulders still. Tuck your tail one more time, and come back down. Awesome, and I'll grab that bar from you here. So you can relax your arms, just keep them low. I'll bring them back up. Awesome. Alright, well done.
Sweet.
Awesome. So now we'll be moving on to the reformer. Okay, so now already that we're on the reformer, we're going to be focusing on something called lumbopelvic stability. So with this, this focus targets your central low back pain, having a greater degree of control over that region here. So lumbar pelvic region has been training that stability, has been clinically proven to have great results. So that's what we're going to be focusing on with these exercises here. The first exercise we're doing is a more simple one. I know you've done reformer exercises before, but yeah, nice simple one called foot series heels. It's just bending the knees and stretching them out. Nice and controlled movement. And yeah, targets that lumbar-pelvic stability, and it also works your glute muscles. So, could you stand up for a second and I'll give you a demonstration?
Yep.
So I'm going to have a lay down here. I've got a red spring and a blue spring on, 2 ones, nothing too crazy. I'm going to lay down, settle those principles again. You know the drill. Awesome. And then feet are facing the sky. Big deep breath in. Exhale to open the carriage out. And then deep breath in at the top. Exhale to let the carriage flow back in. Really control the movement. Nice and simple. Alright, ready to give that one a go? Yep. Okay. Awesome. Great. So have a relax. Awesome. Get yourself set. Let your shoulder blades melt into the floor. And then the big thing we're going to focus on here is that you're not opening that ribcage up into the sky. So with my hand just under here, squash my finger, pretend there's a blueberry sitting there, keep it squashed. Don't want to see these ribs come up. Awesome. And then when you're doing it, before we start, make sure you're not locking your knees out. So you should have a very slight little bit of flexion, bit of bend in your knees when you come all the way out from the carriage. Okay, big deep breath in. And dorsally flex a bit more, yep. Open out. Awesome. How does that feel?
Good.
Breath in and exhale to return the carriage. Awesome. I'm just going to move the heels a little bit higher. There we are. Awesome. We go again. We're doing 8 of these ones here. Very good. Okay. Make sure we're not losing this nice up. Yeah, that's perfect. So keep those toes touching my hands. And I'm also just going to feel here, your tibialis anterior, big muscle here that helps you to do that movement you're doing with your feet right now. It's not working too much, so you're doing a great job already. That's awesome. So I'll give you 4 more of these. Awesome, you're doing very well. Tuck that picture under your chin. Keep going. How are you feeling?
Good. Chill.
Nice. Awesome. Very good. Ready? Keep those feet looking at the sky. Your rib cage is in a great position. You're doing very well. Awesome. And we'll finish there. So slowly control your return. Keep those feet up high. And stop there. Awesome. Do you want to sit up again?
Yep.
Okay. So the next exercise we're doing is very similar to what we just did. And it also has the same target. So it also retrains that lumbar-pelvic stability. And it's really, really similar in that your feet are back on here, you're laying down, but instead of having them facing up, I'll show you they're facing out. So it's called second series external rotation. And this one just helps you also to train your eccentric control of your adductors, which will be helpful as well in your tennis and your swimming. So do you want to hop up and I'll give you a demonstration of this one?
Yep.
And it's also going to be a bit heavier for this one. So I'm going to move another spring onto here. So I've got 3 springs, awesome, 2 reds and 1 blue. Awesome, so I'll have a lay down here. Okay, so it's heels on the edge. Keep your knees nice and stable. Keep your feet, your toes facing the sky. Take a nice deep breath in and exhale out. And inhale, hold, and exhale, draw it back in, really nice and controlled. Same thing, don't want that ribcage flare, tuck it in. And we also I don't want to see this, like that. Just a nice bend. This is where we stop. Nice bend in the knees. So come back in, and we're going to do 8 of this one as well. You ready to give that one a go?
Ready.
Awesome. Good to hear. Okay, so bring these ones out. Make sure they feel stable before you start.
Am I twisting my feet as well out? Or are they staying straight?
Yeah, they're facing out as well, but toes towards the sky a bit more.
Okay.
Awesome. So knees are feeling nice and stable.
Yep.
Tuck that peach, melt those shoulder blades into the floor. Big deep breath in for me. And exhale, push. Awesome. And slowly letting it come in. Are you feeling it on the insides of your legs?
Yeah.
Good. That's good to hear. Very nice. So that's 2 there. So we've got 6 more. And I want you to really focus on your breathing here. And try to control it a bit more when you come back down again. It's a really slow movement. Awesome. You're doing a good job of not locking the knees, so it's looking very good, Eddie. Yippee. Very nice. How many options now? Is that 5?
5 moving 4.
Yeah, I think it's 5. So we're in the 6th one now. So just 2 more for me, and then slow it down even more. Great. Last one, going up. Extend those legs. Great, well done. And come back in slow. And relax there. Great job, Eddie.
Yeah.
Awesome. You want to sit up one more time with me?
Yeah.
Okay, next exercise we're doing is less arms focused, less legs focused, and instead we're working these arms.
Mm-hmm.
So it's called side arm preparation, and it focuses on this bone here and into your spine and that stability here. But it also does challenge your ability to keep a neutral spine and pelvis. It's a really great exercise. You can also get a nice stretch out of your obliques, good mobility, and nice, again, teaching you how to control your pelvis in this movement. So I'll give you a demonstration. This one's a lot lighter on the springs because we are on our arms, but not as strong as our legs. I've just got half a spring here. That's a nice blue one. Awesome, just checking that's working. So when you come up, I don't want your legs to be over here. That's too far. I want them to be about a third of the way up the carriage, maybe even a quarter. So pop your hand down, and this movement, as you come out, so nice deep breath in, and exhale, let this arm float, and let that spine come and stretch, but keep it nice and stiff like a stick. Imagine you've got a stick in your back, your spine's a stick, it doesn't curve, just stay straight. Bring that arm in. So this is not what we want. Okay, that hurts your back too much. It's a nice stick movement. Awesome. Keep that rib cage in. Awesome. So does that look okay to you, Eddie?
Yeah.
Come have a step here. Okay. Yeah, awesome. That should be fine. Get a nice good grip on there. And as you come out, let that nice rise. Pretend you're a bird, spreading your wings as you come out and floating your wing back in as you come in.
So hinging from the shoulder?
Yep, you're hinging from the shoulder here. But I'm seeing a lot of, we don't want to see lateral flexion, that's what I'm watching for. So pretend you've got that stick in your spine all the way down. That's it. Yeah, much better already. Don't have to come all the way in, you can stay a little bit out. Awesome. And we're only doing 8 of these ones. So you've got, after this, you've got 4 more to go. That's good. Spread those wings as you come out. Stop it about there. Very nice. Your hands feeling okay?
Yeah.
Great.
Just sweating.
Yes. Gosh. Here we are. We'll do 2 more. Very nice. And then we'll move on to the other side, but we're actually going to move on to that next exercise. So last one, nice stiff spine. Don't flex your hip and control your movement back and hinge at that shoulder. And relax down there. Well done. Great. We've got one more exercise on the reformer now, and it's called PNF with rotation.
Okay.
This one is really good for your tennis and your swimming because the movement, I'm going to, before we do it on the reformer, I'm just going to explain it to you here. So we're going to be using this hand. So practice it now. Pop your left hand, just grab your fist, pop it onto your right hip bone. And what you're doing, and face your right side. So pretend you've got a head beams here, and you're going to be following where your spine's moving. So what you do, you're going to be a flower girl. You're going to grab the flowers out of your pocket, bring them up, and then open your palm up to the sky and follow with your head beams. This head beam that's on your chest is following your hand. Awesome, so that sort of thing. So I'll give you a demonstration. Awesome. Okay, I'm just doing half a spring for this one again. Nothing too crazy. And come up here. Alright. And big thing to focus on not doing is letting your bum or your center of gravity come backwards as to try lever yourself to do the movement. It's a very nice and controlled movement. Stiff at the hips, don't move your pelvis, don't move your hips, they stay still. So my chest, my head beams facing my hand or facing the posts, and we pull it, bring your elbow up, follow your hand, and then open your palm up to the sky, follow your hand, and inhale, and then exhale, look over to your hand that's moving, rotate that way. And we're going to do that 10 times. Okay?
Okay.
Awesome. Alright. So I'll pass you the handle if you want to hop up here.
Oh, thank you.
That's okay. So, yep, pop it in this hand. And you can, if it's easier, you can just do your thumb and your index finger. Whatever is better, but big focus is that your palm's facing you when you're grabbing your flowers, and it's facing me when you throw them.
Okay.
Or you can also think you're hailing a taxi. So you've gone, oh, give me a taxi. I need a ride. Okay, pop those knees a little bit more together. Yep, awesome. Great. So we're just going to slow that movement down. We're going to break it into 3 things. So start here, rotate a bit more towards me, follow your hand. Okay, grab your flowers, then we're going to stop up here. Keep your elbow high, stop there. So it's boom, boom, and now throw the flowers. Very nice. Open your palm up, and then start again. Just break it down into those 3 movements. Yep. And keep, again, you've got more headlights on your hip bones, keep them facing me. Your hips don't move. Hips don't lie. Keep that elbow raised as you throw them. Rotate. You're doing very well, Odie.
Thank you.
Well done. Awesome. Yeah, so, yeah, nice. Keep that still. And this exercise is really good for rotational stability in your tennis and your swimming. Having that sort of stability will help prevent further injuries. And it also challenges keeping that neutral spine, neutral pelvis, which is really beneficial for your low back pain. Awesome, and up. And we'll do 2 more once you return the correction. So 2 more now. Keep that elbow raised. Yeah, awesome. I want you to do that on the next one, your final one. Last bit of the reformer. Lift it and throw the flowers. And slowly control it a bit more. Come back in, face the posts. Awesome, and I'll pop that one back in. Yeah. Well done. Very nice. Alright, so we're done with the reformer now. The next exercise we're going to be doing is on this one, the split pedal chair. I'm just going to be removing these posts. Here we are, just be 1 minute. Awesome, so this exercise is just called lift and lower. Sorry, I only 1 minute. Awesome. Okay, so with this one, we just have, it's not too heavy, it's 1 black spring on the mid setting, which is it is already set up as. So what you're going to be doing, Odie, is I'll get you to come here, have a seat. This exercise, the split pedal chair, the exercise we're doing here, will be focusing on your ankle stability, because I know you've had a lot of those ankle sprains, that history of the anterior-inferior tibiofibular ligament. So this exercise targets eccentric plantar flexion control, which is really beneficial in preventing further injuries, great for ankle rehabilitation. So what you're doing is you're popping your toes on here. Take a nice deep breath in. As you exhale, point the toes to the ground to let your knees come to a nice 90-degree angle, a right angle here. And then you're going to let your heels drop, but your toes come high. A little movement. And then you point them to go back down. And then exhale, bring it all back up. and then we repeat the movement.
Okay.
Okay, and we're going to be doing 10 of these ones.
Yep.
Yeah, so it's quite a light spring, so we can really focus on that stability. So we'll have a seat here. Right, yep, put your toes on their toes. Awesome. And no, so we'll start again off the top, ready? Come up here. So just point the toes to lower it to about here, to 90 degrees. Stop there. Now I want you to drop the heels, don't move it. Awesome. And now you can lower it a little to point the toes again. Lower it, and then bring it back up.
Okay.
Great. Does that make sense?
Yeah.
So yeah, it's like a little ankle stretch, but you've got to control. The big part of this exercise is control of the muscles that help you to point your toes. And not letting that move in that phase. Yeah, exactly. You did a great job there. Now bring back up. Awesome. Great. So we're up to 4 now. So we've got 6 more now. And just work your way through it. Keep breathing. Exhale through the controlled movements, and then inhale on your way back up to relax. Very good. I just want to make sure you have pretend you've got a string pulling your head all the way up here. Awesome. Very good. Yeah, it's not too unstable for you?
No.
Awesome, and a nice lengthened neck. I like those shoulders. Awesome. Oh, great. Yeah, hips are looking nice and stable. I'll just have a look from back here. Here we go, I'll try to open up a bit more. That looks good. Keep those shoulders back. Awesome, string is still pulling you up. Okay, we'll do 2 more already. Awesome. Alright, last one. And then we've got 1 more exercise on this piece of equipment.
Sweet.
Awesome. Okay, so the next exercise we're doing is an ankle exercise on the split pedal chair. It challenges your balance a little bit more, but I will be reattaching those handles. So do you mind holding on for a second? There we are. And the springs are a little bit heavier, but we'll work our way through it. This one also challenges your, I'm just going to make sure that's height here. Sorry, bear with me.
How you going, Liz?
Yeah, it's a little bit tricky this one, but I'll go. Next one. But make sure it's nice and tight, I don't want it falling over.
Yeah, it's not what I'm making on today.
No more falling.
No more falling.
Yeah, so this exercise helps you to stop falling as well. It helps with your control of your ankles, increases your ankle stability. Here. Sorry, one more time. There we go, righty tighty.
There it is.
There it is. Awesome, okay, so that's nice and tight. And then I'm just going to change the spring settings. So I'm going to add a black spring for this one, for when we do the other side. And now they're both attached, it's on high setting. Both sides on high setting. So now I'm going to remove the stick. Oh, here we are. Yeah, so this is called ankle exercise. So what you're going to be doing, I've modified it a little bit so that we can challenge your balance a little bit more. So what you're going to do is if you have a watch, so I'm going to pop my elbows over here, join my hands. I'm going to pop my knee onto here. If that's a bit uncomfortable, I can pop a little pad in there for your patella. And what you're going to do is pop your toe onto here, so just lower it a little. Take a nice deep breath in. And exhale to point the toes. Keep that knee still, and then exhale to so let your heel drop. And then you're doing the same thing. Here we are. Great. So if you want to give that one a go?
Yep.
Great. Awesome. I might get you to pop, if you put that knee back down, I'm just going to get you to pop this leg back here.
Oh,
Yeah. Awesome. Yeah, I didn't do that, but here you are doing it. Yeah, so join these up. So you're going to lean yourself really over here. This is called the Cossack position. Point the toes. And we're again challenging the control of the muscles of your calves that help you to point your toes. Yeah.
Yeah, I feel it.
You feel it? Good. So we're just doing the right side here and then we'll move on to the left. Nice, really controlled movement. It shouldn't feel jolty. It's more of like a down and then come back up. Very nice, Odie. We'll do a couple more of this one. Great. And you can relax there.
Sweet.
Great. And we've just got one more on the arch barrel. Awesome. Okay, so Odie, we've got one more exercise left tonight. This one is on the arc barrel. Have you ever used one of these before?
No.
Okay, so this exercise we're going to warm down with. It's got what the aim of this one is to mobilize through your lumbar spine, like we did on the Cadillac here. But this one's more of a rotational one. It's called lateral flexion and rotation. We're going to do it on both sides, but we're going to start with the left leg in front and twisting to the left. I'll give you a demonstration, and it's important in this one that you have a nice controlled movement, and I'll show you like what to watch for as I'm doing it. So we're going to sit here, get our feet nice and anchored, and you can bring, for a bit more control, you can bring knee a bit more in. We're going to start like this, and we're going to slowly lower down. Bring that arm over, and you're exhaling. And then the next part is to inhale, face the sky. Really let your, you can feel the stretch here. And then the next part, we're going to face the ground instead. Come over and relax. And then we're going to use our bottom hand, so our left hand, and come back up to the starting position. Does that make sense?
Yep.
All right, let's do it. Okay. So yeah, not letting ourselves just slump down. It is a bit of an oblique ab exercise. Let yourself come down. So I'm just going to watch from over here. Awesome. So make sure you feel nice and strong on this side so that you have some control when you're coming down. So yeah, nice and proud, sitting up tall. Awesome. We want to have a nice neutral lumbar pelvic position, which you're doing very well. So when you're ready, really slowly lower yourself down. Awesome. Bring that arm over. Awesome. Hold. And then inhale, open to the sky. Just relax there for a second. And then you're going to exhale, come back over. Face the ground, bring that arm over. Awesome. Bring your head down. Beautiful. And then you're going to use that left hand to come back up to our starting position, mermaid position. Beautiful. Very well done. Great. So we're going to do another one on this side. Just and then this time try to be even more slow, even more controlled. Imagine you're a mermaid laying down on your rocker after a big day. Awesome. Keep that arm over like this. Awesome. Inhale, look to the sky. Feel that stretch on this side of your body.
Yeah.
Good.
Don't you worry about it.
Awesome. And then bringing ourselves back up. Awesome. Right, now we'll do one on the other side. And now that you've got the gist of controlling it, we'll just do one. We're just going to bring it over like that. Awesome. Thank you. Oh, we just, that leg was
Yeah,
just
we've already
right.
done this leg.
Yeah, sorry, you're facing. Sorry, I confused you by twisting it. I thought
I'm wiggling out to make sure even more.
Awesome. So now we've got the right leg in front, which is correct. Awesome. Hands like that. Awesome. Do you feel nice and secure and grounded here?
Yeah.
Good. And then keep that note before you go. Like that. Awesome. And control down. Nice, Odie. Arm overhead. Inhale, open to the sky. Come down. Like a sad mermaid now. Awesome. Then use that bottom arm to push yourself up. Awesome. Very well done.
One more time.
Yep. One more. Nice. More control on this one. Calming down. Keep that bottom arm to the sky. Awesome. Wow, good job.
I'm testing my balance.
And then coming sad mermaid. And coming all the way back up. Neutral mermaid. Okay, great. So we've just got so the class is now over. You've done very well. How are you feeling?
Great.
Okay.
Feeling stretched and better recovered.
Awesome. Okay, how's your back feeling? Was it too much load? Are you feeling alright from
No,
the
it was
reformer?
perfect load. It was good.
Yeah,
So
still
I felt like I was getting an exercise without straining my lower back.
Good to hear. So before I send you home, I've just got 2 very simple exercises for you to do at home. These are ones you can do daily. It's okay if you miss a day. They're very simple. So I'll show you the first one. It's called, it's just a hamstring stretch, but it's called contract relax. So I'll just give you a demo. So we're gonna get this one out of the way. This is a principle, as I said, contract relax, where you put yourself in the stretch and try to hold it, come back up, relax, and then the next time you go down, you get a little bit more length.
Yeah, okay.
So this is for those tight hamstrings. You'll be able to bend your spine a bit more, which will be good for your tennis, getting those hard shots. Awesome. So we're going to start here nice and straight up, and we're going to bring those arms down. I'm just going to grab my ankles. I'm going to hold here for 5, 4, 3, 2, 1. Come back up, and this time hopefully I'll get some more length, which I have. Awesome. And you just keep doing that and get repeating, finding that difficult position, relaxing, doing a bit further. Awesome. Do you want to show me how you do that one? Awesome. Hold. Nice stretch there.
Yeah.
Awesome. Relax for a second. Breathe. And try to go a bit further. Awesome. See? Got a bit more. It's something about your nervous system, and it sort of lets you go a bit further after stretching it a little bit.
Yeah.
So that one, yeah, just do a couple minutes of that, and it helps with the deep breathing to relax a bit more. And now we've got one that's called single leg hopping. This one's for the ankle instability on your left side, but we're going to train both those ankles to try so that you're less prone to doing ankle in tennis, and it complements those exercises that we did on the Wonder chair, the split pedal chair. I'm just going to move this out of the way. We're going to do it here. So you don't have to use cones at home, but they're here. Make it a bit easier for us. If you really want to, you can get some random socks or shoes, use them as markers. So we're going to go like this. And it's not huge steps, I don't want you to fall over. You're going to pop yourself in the middle. And we're going to do one leg at a time. We'll start with your left, because that one's more important. What you're going to do, hands on your hips, nice and stable. You're going to start with little hops. Finish going forward, backwards, to the right, whoop, to the middle, go to the left, just whatever way you want. Or you could have, you have a partner, don't you? If you could have him say left, right, back, left again. Okay. So give me a demo of that.
Okay, facing this way?
Yeah.
On the left foot?
Yeah.
Alright, you.
Only little ones, I don't want you falling over on me.
Okay, do you want to tell me where to go, or do you want me to make up my own mind?
I'll tell you.
Okay.
Forward. Awesome. Back. Left. Back to the middle. Right. And back to the middle. Great. So you can relax there. Awesome. So that one, yeah. So those 2 exercises, try to do them daily. They're not too difficult, and you don't really need anything to do them. You don't need any of this big equipment. Try to do them daily, and if you feel like you're overdoing it, if your ankle sore one day, don't worry about it. Just do it the next day or the day after. If your hamstrings are extra tight, here's a good day to do those stretches. And then just the last few things before you go, just with your posture, make sure we're staying up nice and upright. When you're around exam periods or when you're doing a lot of study, try to stand up every now and then, move around, break sitting quite often. And did you have any questions?
No, sounds great.
Awesome.
Thanks.
Great.